Good evening, everyone. Sorry it's late this evening. We've had a bit of hassle here. Bunch of kids causing problems, had to call the police. Not very happy about it. I'm very tired. But unfortunately, my insomnia is kicking in with the medication now. Now, there's something I wanted to talk about other than my treatment at the moment. I'm going to do a separate video for that. Is everybody talks about extrahepatic manifestations. Well, I've been looking up a couple, and it seems that there are some that are recognised. And one of the biggest ones is oral problems. And I mean that in the nicest possible way. I don't mean anyone's got a bad mouth, and I certainly don't mean it in any other way. But we have a tendency, and I always wondered about this, because my teeth, they look not too bad, but most of the top ones are gone now, and the bottom ones are very wobbly, and I would get lumps everywhere and things like that, and I thought it was just me, but it's not. There's a thing called, now I've got to get this word right and I'm reading it, so excuse me, is cryoglobulinemia. It's an oral condition associated with hep. We are far more prone to it than other people, and it means we get lumps, little tiny, they can be from a pinprick size to about a centimetre inside our mouth. We're more prone to oral cancer, obviously, but this has actually been proven. I've got a PDF if anyone wants to read it, and I've got documents that I've bookmarked if you'd like to read up on it. And I'm not doing this to try and scare anyone, but everyone says, oh, there's no proof, there's no proof. Well, actually, there is proof because I've been doing some research. And this thing comes under another heading called lichen planus. And that covers a multitude of sins. So, what happens is, I don't know if anyone else has it, but I do. I don't know if you can see this. They look like moles, but actually they're not. And they're not cancerous either. They are benign. This lichen, whatever it is benign. I can't sort of hold it properly. But I get them all over my legs. I get little lumps, and they come off like lumps of dry skin eventually. Well, this is part of hepatitis C, apparently, which is one of the side effects. Yes, there is proof, which I've also found, of lupus. I've been looking up these things over days because people have been mentioning it in the groups, and I wanted to point out that there are certain things. So if you just bear with me 2 seconds, the camera's going to move around a bit, because I'm going to have to move my software over that way so I can read what it actually says about the extrahepatic. Sorry about this, just bear with me 2 seconds. Right. Right, this cryoglobulinemia is among the most common and closely linked extrahepatic HCV manifestations, and is most often a mixed of type 2 or 3, considered a lymphoproliferative disorder. So that involves your lymphocytes. It is thought to result from chronic stimulation overreduction of B cells producing immunoglobulin. The disorder is characterized by these abnormal blood-borne protein, which we get, which people precipitate and aggregate into gel-like substances at reduced temperatures. When these globulins aggregate and form gel-like substances, they cause clinical signs and complications through occluding vessels and inflicted target organ damage. So basically, this is what in the long run damages our organs as well. And it's not just the liver, it can be any organ. Any organ where these lymphocytes can go, or these immunoglobulin, whatever they're called, can go, it seems can affect our organs. So everyone who says, my doctor says that doesn't happen, actually it does. I actually joined a medical site so I could get this information for you. Symptoms relate to the organ affected and can range from joint pain, muscle pain, acute kidney injury, and more commonly manifesting in a vasculitic syndrome, where we all know, vasculitis. And if it's critical, it can result. Now, I'm not doing this as a scaremonger episode, we're all adults. It can result in the loss of limbs, particularly digits. I suppose it's a bit like, it's not the same, but it's a bit like the idea of diabetes, when the stuff doesn't get to the right limb and boom, Bob's your uncle. I don't know anyone with that, but I do know people who've lost their legs, etc., through using. So maybe that's what it was, I don't know. And when I say using, I mean, yes, using drugs. I used to work with addicts a long time ago. Other non-specific symptoms include lethargy, are common, with the most common symptoms including arthralgia and pruritus, whatever those are. But when I looked everything up, it just gives you bigger and bigger words. So basically what it comes down to, it's a critical assault from this particular thing, because we have an autoimmune disease on all our organs. Even apparently when we have treatment, it will carry on. Hence why people are still feeling awful, rubbish, crappy, and the rest of it. And this is documented on Medscape, which is quite a good site. At first, when you first get the symptoms, they would automatically screen for hepatitis. That's how known it is, that if somebody went with all these symptoms, the first screening they do is hepatitis. Well, they might do in the USA, but they certainly don't in the UK, as a lot of us know. They do urine analysis to check all our levels. Our rheumatoid factor is taken into account. And some point to, like with mine does read a coexisting disease, which is my blood disease. And maybe haemophiliacs would read that as well, or anyone who has, heaven forbid, cancer or anything like that. If you've got another disease, especially an autoimmune disease, it would definitely be that in the reading. Excuse me. And our chest gets affected as well, by the way. Mine is to do with use of smoking, but it does affect our chest as well. And it can affect our lungs terribly, which Julie Daniel has pointed out on many occasions. And yes, it does affect our lungs. That is one of the organs it will affect. Not only the liver, it affects the kidneys. And in worst case scenario, can affect our pancreas. But let me get back to the original thing. I'm going a bit off track here because there's so much of it to talk about. I'm trying to keep this sort of to the teeth. I don't know about anyone else, but as I said, this lot are gone. These are all false. It destroys the roots of our teeth as well, so we get very, very wobbly teeth. Our roots become ruined. My dentist actually told me this. She's very up on it. She's an excellent dentist. Took me ages to find her. And the hep eventually destroys the roots of our teeth. So either our teeth fall out or need to be taken out. Doesn't matter how clean we are with our teeth, how hygienic, it comes from inside, because it's the autoimmune system breaking down. And that affects the roots of our teeth, because we can't get the things it needs to keep our teeth strong enough. And especially when we can't tolerate, this is one thing I found quite interesting, we can't tolerate a lot of the foods the longer we go on with hep C that we need to keep our teeth healthy. So hence that's another reason why we have bad teeth, or can have bad teeth. Some people are lucky and don't. I'm unlucky and do. Doesn't matter how many times I brush my teeth. I've got those little things you push between and everything. Doesn't matter. Your teeth are ruined. My dentist is actually pleased because she hasn't had to take a tooth out for over a year. And she thinks it's really good. And I'm really fussy with my teeth now because of the problems I've had. I'm even more fussy. But this is one of the EHMs that don't exist, they keep telling us. Another one, manifestation, is neuropathy. Common. It's been reported in up to 90% of patients. Excuse me. I'm trying to get some sleep, so I'm having hot milk. And it's peripheral neuropathy, which is the edges of the brain, apparently. But 90% of us get this, what we call brain fog, which I'm going to do a totally different thing on as well. This is the oral hygiene one, and the spots. I was very ignorant at the start. I mean, I always knew about hep C and I always knew about AIDS because I worked with addicts. But I thought only people with HIV got lesions. Not correct. Some people with hep C can get lesions. Does not mean you've got HIV. It just means you've got this problem, and it can cause lesions, like lesions, like the spots on your hands. It can turn into a lesion here. So, yeah, that was an eye-opener for me because I've got one coming up. I can't actually see it because my neck's too fat, but oh well. I've got one coming up here now, and it doesn't irritate me, it doesn't bother me. Occasionally it itches like a dry skin and I keep it well moisturised. But it seems to sometimes come up and then sometimes go down. So that just seems to be the way it goes. We all know about liver spots. It's the same principle as liver spots, and whichever organ gets affected throws out its own problems, like different spots, different lesions, different markers, and that's what doctors look for. Hence my hands, I mean, you can see my palms. Yeah, you can. Very, very red. Now, every time I go and see a doctor, they always look at the palms of my hand. Mine are very, very red, and around my nails, around here, very, very red. And people often say to me, "Oh, you burnt your hands." And I say, no, that's the liver. And that's what we get with liver problem. So, not very nice, but there you have it. So all these things do affect us. EHMs are real. If you have a problem, I suggest going to see your doctor. If you would like any of the information that I have, just private message me or put it in the comment section, and I will copy and paste what I can for you. Saying that, sorry I disappeared for a second there. I was just bookmarking something. Vasculitis again. Therapy is targeted at, this is what any of the therapies that we begin is, treating the underlying hep C. Go figure. And immune targeted therapy, which is what I had for my spleen, but I don't need it anymore because it's not working. So at the moment, that's the first video on EHMs, and it's to do with teeth and oral hygiene. You know, just keep going back to a dentist. If you're not happy with your dentist, change them. It is known. Lupus is known. And these are documented facts that we have problems with EHMs from hepatitis C. So if you'd like any of the documents or any questions or anything you'd like me to try and look up and find out for you, I will. Unfortunately, when I do these, I have to read off the screen, so it looks like I'm being rude, but I don't mean to. Anyway, I will follow on this with another EHM about brain fog, because I'm still finishing the study on that one, and I've got my own video to do because I went to see my nurse and I found out some not so great things this week. I mean, my treatment's going well, but on the scale of other things. So I'll talk to you guys later. Love you all. Bye.